Live from Huntertown, Indiana, it's Soarin Hawk on the air. And today we have a special attraction. We have brought along our celebrity here, okay? our new vet tech, Maraiah Russell. And some of you may have seen her around at the zoo from time to time or down there at Little River Wildlife Project. Or wildlife? Wetland project. Okay, I'm into wildlife. I don't know wet. Yeah.
We have lots of wildlife there too.
Okay, so anyways, Maraiah is our vet tech, and she's been with us since what, May?
No, just August.
Just August?
Mm-hmm.
Jeez, it seems longer than that. Oh, I'm sorry. Yeah. So anyways, what Maraiah does is she's in charge of our ICU. She takes care of the medical treatment of our animals, the evaluation, and see what needs to be done with the animals. Now, a lot of times, we get phone calls in with people that have found an injured bird or a suspected injured bird, and we send people out to collect the bird, bring it in to us, and sometimes they will do an initial evaluation about what's going on with the bird. But we bring it in and we go over and check out the bird and see what's wrong with it. So today, Maraiah is going to show us what she does with the birds when they come in. So I have a couple of guinea pigs here. So if Jeannie and, not Grumpy, Chewy Bacca would come up, she can talk about some of this, so.
You've upset him, man.
I've upset him, yeah. Yeah. So she's going to show us what she does with the birds, and Chewy says, well, yeah, he's already decided that he does not like veterinarians. So it's going to be like your typical dog or cat.
So I'm a veterinary technician, and a great way to think about that is compare it to a nurse. So I'm not the veterinarian, which is the doctor. I do nursing care for animals, and I can do assessments on animals when they come into the ICU. Our volunteers do a great job of doing triage, which means the initial assessment when they first come in and they're hurt. And then as soon as I can, I go in and do a full physical exam, which might include some blood work and things like that. So I'm going to kind of walk you through what we're looking at. So Chewy's a great example. You can look at a bird from a distance and judge by their behavior how they're feeling. So Chewy's a nice healthy bird, and he's standing tall, and wings are folded, being held tight against the body. Eyes are nice and bright, and pupils are looking forward. They're the same size. So one of the things that we see a lot is trauma, whether it's a fly strike into a window or whether they're hit by a car. Some of those things we can tell from a distance. So if the pupils were different sizes, that's one indication that they might have head trauma. Also, if they're not tracking you, so Chewy, Bob, don't distract. Chewy may not be paying attention to my, oh, there we go. So he's watching my finger, he or she, I'm sorry.
He
is tracking my finger very well there and watching us very attentively, so we know that probably his vision is really good and very healthy and no issues there. But if a bird couldn't track you or was holding their eyes halfway closed, it could mean that there's an eye injury, which we see a lot with head trauma because their eyes are so big, they're not very well protected if their head gets hit. Birds also have a very thin skull. A lot of their bones are very light and thin to help them with flight. So actually a hit to the head can be very damaging. So that's one thing that you can look at to see how they're feeling. They also might close their eyes if they're not feeling well. Just like you, when you have a headache and you're closing your eyes, they can do that too. You see the nice gular action there. So he's getting a little stressed out. So you can tell if an animal is stressed by how they're breathing. If they're breathing really rapidly, that might be stress. If they're breathing too slow, that could be an issue as well. So another thing, so those wings I mentioned, they're nice and tight against the body. If he was drooping the wings, that could mean a wing injury, or it could just mean that he's not feeling well, that he's got another illness going on. If are holding one leg up or perching abnormally, that's another indication. There could be a leg injury, or sometimes they're just not feeling well and they're sitting down low. So all of those, you could tell a lot of different things from a distance.
Gripping?
Oh, gripping. So they should be holding on to a perch or a hand, a gloved hand, because those talons are very strong. So yes, good job, Chewy. So yes, if they're not gripping well, that's another indication that there could be an injury there. And they have very strong talons and very strong tendons. So it could be a bone injury like a fracture, or it could be just a tendon sprain. Lots of different things that could be going on. So when a bird comes to us, it's important to watch from a distance first to see what the behavior is. And then what we're not going to do with Chewy today is restrain the bird for a full close-up exam. And we do that safely, again with gloves, protecting ourselves from their talons and their beaks. Those are their two weapons and what they use to hunt. And those things are all really important to its health, because if it can't hunt, obviously it can't survive in the wild. So I'm going to walk you through kind of here on this mock bird that one of our volunteers has made. It's excellent, complete with bone structure and everything. So I mentioned the eyes. One thing that you can check on the pupils, we have an ophthalmoscope. This is just like you would see at the doctor's office. And just like at the doctor's office, it's going to get a head to toe exam. Birds are different in going to the doctor because they can't tell why they're feeling bad. Okay, so you can maybe see that they're feeling bad, but there's no indication. So you have to take all of these things into account. So you might shine a light in the eye and see if the pupil responds. It should shrink down because you're putting in more light. So seeing if their eyes respond to light. You can look into the eye and see the structures of the eye with the light. Again, to see if there might be blood in the eye or other damage. One thing that we have is a stain. This is actually, it looks orange, but when you drop saline on this and put a drop in the eye, it will dye any cuts on the eye a bright green. So when you shine the light on it, any damage to the surface of the eye will show as a bright green, and we can tell what kind of medicine to put in the eye based on that test. Then you might look in the mouth. So eyes, mouth. So this isn't a very accurate mouth, but this is a nice pink tongue. Sometimes, really though, the bird's tongues are kind of light colored, but the inside of the mouth should be nice and pink in most birds. That will tell you if they have good blood flow, because again, we see a lot of trauma. Hit by a car or flying into a window, things of that nature. And if there's a lot of blood loss, they might be pale. Another reason they could have pale mucous membranes in the mouth would be parasites. So if they have a heavy parasite load, worms, they get worms just like your dogs and cats do. Those could be a reason for them to have a loss of blood there. So you look in the mouth, you want to make sure the trachea is nice and clear. No obstructions in the trachea. Some diseases, you can get little growths on the trachea. If the bird has been sick for a while, they might have a yeast growth going on inside the mouth. So a lot of things you can tell by looking in the eyes and the mouth. Now this bird, I don't think it has ear holes. Are there ears? So another thing to check is their ears. One thing that I've seen, a bird came in. You wouldn't think there's a whole lot to see illness-wise in the ears, but the ear was very swollen and red, and that let us know that there was head trauma. So you can tell things like that by looking in the ears.
Don't you sometimes get some kind of parasites in the ears?
Right, you might get also mites as well, and really we check all over the body for parasites as well. There are external parasites. Hippoboscid flies, also called flat flies, are favorite volunteers in the ICU because they kind of fly really shiftily, really stealthy flight, and they sneak under the feathers of the bird, and they can sneak out and get into your hair. So that's not very fun at all to have that feeling.
No, I'm going to be itching.
Yeah, we do have a powder that we dust the bird with to kill those flies. but we also smash them as they come out. Going down the bird, we will do a body score, which will tell us how much muscle is on the bird. And again, that tells us, has the bird been hunting appropriately? Does it have good nutritional status? So here's the keel. So instead of a diaphragm, like in mammals, which we have to move air in and out of our lungs, they have a flat bone plate over their chest called the keel. And it has a ridge on the front, and you can tell how healthy the bird is by feeling the muscles around that keel. And so if the muscles are pretty even or sloped down slightly, they're going to be convex like this, then that's good muscleage. If it's concave and you can feel almost to the bone plate at the bottom, then that's a really emaciated bird and they're very thin. Yeah, that's good. Thank you, Bob. Like this one, you could see the keel is very prominent, and then when you feel the muscles on the side, it's very thin. There's not a lot of muscle there, so you know that you're dealing with an emaciated bird that has nutritional deficit, and they're probably going to need a lot more care, nutritional support. And that probably means that they have an underlying disease, so that's something that's been going on for a while. So maybe they have an old injury that didn't allow them to hunt, or a disease process that's made them feel sick for a long time. Then we move to checking the wings. Wings are very important for flight, obviously. And we palpate. So palpate just means to feel. And you can feel if there are breaks or fractures, often with major fractures, just by feeling it and seeing if there's mobility in these bones. So they have same bone, like humerus, radius ulna, and two metacarpals. So this would be the elbow, and this would be the wrist, and this is your shoulder. So we feel all of those. I think over here we have a broken bone. So when you hear crackling like that, that's called crepitus. And then you can see there's movement back and forth. So that would be a fractured humerus there, which is can be repairable, and we do have a veterinarian that we work with. So when we find something serious that needs surgery, we take the bird to our veterinarian, and they repair that for us, and then they come back to us for further nursing and supportive care. So on with our physical exam, we feel, boy, these aren't very solid bones. We feel the bones in the legs. And we check the movement. Yeah, isn't this fun?
We don't want to see a bird like that at the ICU.
So you feel, again, a lot of palpation, a lot of feeling to see if everything feels normal. So our ICU volunteers are very experienced with knowing what normal feels like, so they can tell when something is abnormal, and they can tell when something's wrong. And all the way down to the toes and the talons, we need to check all of those things as well. And then we check the booty. So they have a single opening called the cloaca, where feces and urine and urates are expelled. So we make sure that's nice and clean, and that there's no runny feces like diarrhea. Again, that can indicate something gastrointestinal going on. We check the tail feathers to make sure they're nice and clean and complete and not broken. And then we turn the bird over, and we're going to check for injuries along the back as well, along the back of the legs. We really look the whole entire bird over. One thing they also have to help them breathe, I talked about the keel. They don't have a diaphragm, they have this keel. So the keel works like a bellows to move air in and out, and birds are very efficient in oxygen exchange because of that. They always have air flowing and oxygen exchanging, and they have air sacs throughout their body to help them do that. So we want to make sure all those air sacs are functioning. One thing that we recently had was a young great horned owl come in, and when feeling for a body score, we could feel lots of air under there, and it felt kind of like this crackly paper. It felt like bubble wrap, and so it had an air sac puncture right here on its body, and that air sac was actually leaking air under the skin all over its body, so it had some air pockets here. It had that real crackly feeling, and so we knew that there was communication to the air sac, and that bird went to the veterinarian, got sewed up, and is doing very well in ICU at the moment, and we're hoping to release it later this year. So if we can't find anything obvious, we might draw a blood sample and see if there's something abnormal going on there. A blood sample would help tell if there's a systemic infection going on. We do have a microscope and all the tools that we need to do what's called a complete blood count in the ICU. And so we would have a syringe just like at the doctor. They don't necessarily stick out their arm like you do for a blood sample. So we would hold them. They have a very nice jugular vein that runs on the right side of their neck. So we would draw a blood sample from that and analyze that to see if they have a high white blood cell count or not. Something else that kind of comes up during the rehab part, so sometimes they have a minor injury. It could be just a sprain and not a break. Or after a major injury like a fracture that they've had pinned, they need physical therapy. So that's one thing, again, that the ICU volunteers help to do on a daily basis. So I haven't mentioned yet that these birds get looked at by volunteers twice a day to assess their health and to give medications. So they get a lot of care. And one of the things that we do to check range of motion, because before a bird can be released, it has to be flying very well and able to hunt on its own, is we can measure the range of motion with this. This is called a goniometer, and so it gives you a range of degrees of how far the wing can stretch. And so that's how we know if our physical therapy is working. Have I left anything out? I talk very quickly.
What's normal on the goniometer?
Oh, that's a great question. I think it's species specific, and I am new to that goniometer, so I couldn't tell you the normal range. And it depends on what joint you're measuring to.
How is PT done on the bird patients for a wing?
So we start out kind of gentle, and then work into more. And this one isn't stretching very well. So normally, to tell you the truth, that the elbow will stretch pretty almost straight. And so we will take it into an extended state and hold it for several seconds and then release. And then do that again for several reps. And then we'll repeat that every few days. So we'll give them a break and then repeat that again. It's often a little painful. If you've ever gone to physical therapy yourself after an injury, you know it's not super fun, but it helps you get your mobility back, and that's what we do for these birds as well.
Do you ever have to do physical therapy on the legs?
Yes, especially, yes, for toes. We sometimes get injuries that causes contraction of the toes, and they need to be able to extend those both to hunt and to perch. So yes, we will do physical therapy on the toes. And these bird medications, so fluids, warm fluids, just like you would get at an emergency clinic if you're dehydrated, or if you've been in a severe accident. They put an IV line and put in fluids. We can do an IV, but that would only be for a really severe circumstance. We typically give them under the skin and let them absorb them slowly. So they get fluids right here in the leg web, which is a web of skin between in the inguinal region, between the body wall and the thigh. That's a typical place to put it. You can also put it over the back, under the skin, over the back, along the spine. So fluids is a supportive therapy that we give. We also give anti-inflammatories, very similar to your ibuprofen you would take to decrease swelling and help with pain. And we also can give antibiotics too to help any infection that might be going on. Again, we look at blood work too to kind of guide us in that, or if we can tell signs of infection, if there's any redness or swelling at a site, or any discharge. Yeah, a lot of what you might call pus. Sometimes it can be creamy, cheesy. Those are like not fun things to think about, but things that we deal with on wounds. And another thing that's not really fun to talk about either, if there has been an open wound for more than 24 hours, you might start getting maggots. So flies can take advantage of a sick bird and lay their eggs in the wound. So we actually have to clean out the maggots in some of the wounds as well. Lots of fun stuff in ICU.
Yeah. So,
Um,
what about back injuries?
Sometimes there's spinal injury, and you could tell that by another test that we do is a pain response. So we actually pinch the toes pretty hard to see if there's what we call deep pain. If we pinch the toes very hard and the bird doesn't pull back, that probably means they aren't feeling anything in those toes, and you could do it high up to see where they are feeling and where they're not. So sometimes that paralysis is permanent depending on the injury, sometimes it's temporary and they just need some rest to recover. But yeah, that's a good point. I thought of another test that we do. We can test their feces for parasites. We talked about parasites, and one of the standard medications that they get coming in is an anti-parasitic. So we can check the feces, again, under the microscope to see if we see parasite eggs. If so, what kind, and then what kind of parasitic treatment they might need.
Wow. You're giving this guy an A to Z examination,
Yeah.
and he still looks kind of flattened.
I talk pretty fast. But
Okay. I know you did. You just want to get off the stage. You know?
I won't lie.
So,
I have a question for you.
Okay.
In order for someone to volunteer at the ICU, what experience do they need?
Well, Gigi, who is a wonderful volunteer manager, will set you up and start training in ICU with one of our experienced leads and with Diana, who's kind of in charge of our ICU volunteers. And so through that training, they'll walk you through all of these. You will observe for a while and all of these things, and you will help do more of the cleaning. There's a lot of cleaning that has to be done in ICU to provide a nice, clean, and dry environment for these birds to recover in. So you'll start out doing that and learning along the way about all of these things that I've just told you.
So we don't need any medical background for people.
Right,
Just want to
right.
make sure everybody can go and they can learn.
Absolutely,
Yeah.
and we need volunteers, so
Yeah.
please, if you're interested, contact Gigi, and I'm sure her information's on the website.
Yes. Yep.
Yes.
Yeah, so you'll contact Gigi, and she'll invite you for an orientation, so you understand what all is required, what if you will, the rules are, because we are controlled by the feds and by the state, and so we have to obey their rules so that we can stay in operation. And then after that, so Gigi might introduce you to a whole totally new thing, you know. But anyways, yeah, we can use as many volunteers as possible, and you just don't have to volunteer at the ICU. Many of our people do dual duties, you know. So we have people that go to the ICU, then they come out and they work with the birds for presentations, for handling, for training the birds, and or just for the day-to-day maintenance, you know, feed and clean.
Yeah.
You know, so there's all kinds of jobs out here, you know, and so it's just not one thing. And we ask that you can give us at least 2 hours a week. You know, 4 would be better. You know, 8 would be just great. You know, and like some of us, you know, 20 hours a week. Okay, so you know, so anyway, so anybody can volunteer, and we're grateful, and we're conveniently located in Huntertown, Indiana, just off State Road 3. So we're not hard to find. So let's see.
I
What else?
didn't mention the stethoscope.
No, you didn't mention it. You didn't mention
I
it.
did the
That's
full
fine.
exam and I didn't listen to
Yeah,
the word.
well, I don't think their hearts are working too well.
So one major thing that we do is listen to the bird, and just like at the doctor, when you put the stethoscope on your heart, we can put that over that keel and hear a heartbeat. Again, whether it's fast or slow, birds have a very fast heart rate, a very high metabolism. So if it's slow, we know there might be something serious going on. And then we can actually put it over those air sac sites as well, because we want to make sure that the air sacs are nice and clear. If they have a respiratory infection, sometimes you can hear crackles, either in the lungs, which are situated, again, just kind of where you think they'd be under that keel, or in the air sacs as well.
Okay. So you get a
That's
real
a major
thorough
part.
examination better than you get at the vet's office. Okay, so no more questions. Okay, so they go through ICU, you get them nice and healthy and everything. Then what happens to them?
Well, then they will come out here to the pens where the animal care handling volunteers that here will take care of them, and they go through some tests. So if the bird came in as a juvenile, it will have to prove that it can live feed, which means we give them some mice and they have to hunt them down themselves so that we know that they can survive on their own in the wild. They do flight testing, so we have some really large flight pens to make sure that they're flying well enough, again, so that they can hunt and survive on their own. And if they pass all of those tests, then they get released.
So, and that's the best part of our job, is getting those birds back out there. You know, all the rest of it is work.
Yes.
A lot of it's not glamorous at all. You know, it's kind of like taking care of children. There's, you know, some days, you know, when they graduate is great, but you know, in between there's a lot of work that you have to do. So,
Absolutely.
so anyway, so this is what we do, and we have probably 8 different flavors of birds that come through here, and everyone presents a little bit different situation, and every time you go out and you pick up a bird, you just don't know what happened. Sometimes we're just lucky that it's just a slight concussion or something, and the bird recovers fairly quickly, and other times it's you know, a major disaster.
You want to talk about juvenile birds and maybe how you should leave them if they...
Oh yeah, well, yeah, that's the other part, is that when our volunteers go out to rescue the birds, you know, sometimes it's not really a rescue, but it has to be an evaluation of the situation of you know, what you're seeing, you know, because like things like great horned owls, they're babied, they're kept until about October by their parents. Okay, and so a lot of times you'll find great horned owls sitting down on a log doing their begging call. Hoping, you know, well, in fact, you can hear Chewy back here every so often gives that begging call. You know, so sometimes you have to look at the situation and see, here's the baby, there's mom, there's dad. If there's nothing around to bother the bird, you know, there's no dogs, cats, or kids, you know, pretty well you can just leave the bird alone. So in the springtime we get a lot of calls, you know, that baby birds have fallen out of the nest. If they fall out of the nest, you can put them right back, okay? Birds can't smell, okay? Well, actually they do a little bit, but they don't care about human stink. They care more about the odor of their kids. And so, you know, so either the kid has gotten rambunctious and fallen out of the nest, or maybe mom and dad just decide to get rid of them, you know, which sometimes does happen, you know, because there's some failing in the bird. They know that the bird's not going to make it. So when you find baby birds, you know, you can call us, you can talk to us, you know, 241-0134, and you call us at that number, and Lynn will take great good care of you, and she'll give you instructions on what to do with the birds, you know, like leave them alone, put them back, that kind of thing. But we've had strange situations where we had, you know, one of the things that birds do, like the cavity nesters, when the nest gets too foul, mom takes them out of the nest, puts them out there on the branch. Or she leads them away from the nest because she doesn't want predators coming up and finding the babies. So we had a case up in LaGrange where mama took the babies and marched them right up the steps of the library to the library and out the other side. Okay, you know, a rescue was not necessary, okay, but it was very interesting for a little while, you know. So you never know what the birds are up to. So it's so when it comes to baby birds, it's best that you leave them alone, let nature take its course, let mom and dad, or mom and dad birds, that is, you know, let their parents take care of them, and you know, keep the birds safe. You want to keep them protected, but because once they come to us, then those baby birds think that we're their parents. So they become what they call habituated. And we don't want that, because then they won't ever want to leave us, okay? So they're like millennials. They don't leave home, okay? So they're going to stay, and, you know, want to be fed, want to be housed, that kind of thing. So, you know, so it's always best, let nature take its course, let mom and dad take care of the babies. And you know, you'd be surprised, you know, you just stand there for a few minutes and just wait, stay away from the babies, you know, let mom and dad come down and take care of them. They'll lead them off into the woods, you know, and these guys, even if they fall out of the tree, a lot of times, like the owls, they actually have toes like woodpeckers, so they can actually climb up the bark of the tree and get back up to the nest or get out of the way. So so they can, or the mothers can lead them off into the woods. I found vultures, that were supposedly in bad shape, and it's just baby, mom led baby off, hit him right there behind a log, and so went out. Nothing wrong with the baby, he's just fine. So so sometimes we just have to look, see if the parents are there taking care of them, and also one of the other things is sometimes you don't want to approach those babies because if you remember looking at Chewy's talons there, if mom decides to take exception to you playing with her baby, you could get very hurt. Okay, and I've seen the researchers, they go after great horned owls. Go up to the nest. They wear hard hats, goggles, heavy coats, leggings, all kinds of stuff to protect themselves, and still they get hurt. Because 4-pound bird hitting you at about 20 miles an hour, that hurts even if you aren't covered up. And so I've been very fortunate. Knock wood. But so baby birds, it's best let mom and dad take care of them. We make very poor parents. We can feed them, we can nurture them, we can keep them protected, but we can't teach them all the little intricacies that they need to know about. And so we do the best we can. We have Mouse College where we train them to catch live food. We have big pens that we fly them back and forth in, and we can assess that they fly well. But we just can't do a 100% job like their parents can. So.
And we didn't say some of these birds, obviously if they have an injury that's permanent and they can't heal from, for example, like a wing injury that doesn't allow them to get their normal flight back where they could hunt on their own, then we do have options where we might keep them and use them as an ambassador. So we have a collection of education birds that go out to programs, and they get to teach the community about how what they can do to protect these species. And then we've got Freckles, and
Freckles is the one on the glove.
would you like to introduce yourself? And
So you've seen me before, I'm Nicole. But Freckles came to us earlier this year. She came in as she's a second year now, so earlier this year she would have been our first year. But she had an issue with her crop, which is where they store their food, and then also an issue with her eyes. So her crop resolved itself, so it's completely healed. But her eyes still have issues. She can't see well enough to hunt on her own. So with our bigger facility, we have room for more birds, so we decided to keep another red tail. So that's how Freckles came to us. You're okay.
And we also have a volunteer who helps place some of these birds at different institutions. So zoos or other wildlife areas that need birds to use for education, our birds can go there and be ambassadors.
Now, one of the things you do with the birds, our ambassadors, you examine them, right?
Yeah,
Frequently?
so our birds here get physical exams, again, just like your cat or dog would go to the vet for a physical exam. We can do that here to make sure that they're staying healthy. The volunteers that take care of them daily are very good at spotting little things that they might exhibit that shows that there might be a problem going on. They also feel their keel, just like I did on our ICU bird here. They feel their keel to judge nutritional status frequently, and they get weights on the birds, and they monitor how much they eat every single day. And so they have really close tabs on how these birds are doing and if there's any issues with their health. And we can do the same kinds of things with our ICU birds, providing medication, drawing blood for a further exam, things like that. So they get cared for very well.
What about their beaks and toes?
Yeah, so they are on a frequent talon and beak trim schedule. And Freckles' beak is actually just a little bit overgrown, and we'll get a beak trim soon. There should be a shorter, sharper point on that. And that can happen just because they aren't using it the same as they would in the wild. So we help them with that, and also because we are having them on the glove often for presentations, and so we kind of like to make those a little more dull since they aren't having to hunt as they would in the wild. So we do feed them mice and chicks and even venison, which is pretty fancy. So they get fed very well, but they don't have to hunt live food anymore. And so some of those things get overgrown and they need maintenance, like the trims.
Yeah, so, okay, so that's what our vet tech does. We keep her really busy, and she comes in early in the morning, what, about 5 o'clock?
5 to 5:30.
5 to 5:30. Gee whiz, I'm not even thinking about getting up. You know, and so all these people in the ICU work for hours every day, you know, making sure the birds are kept healthy and are well taken care of, and then, of course, getting them up to a nice healthy state so that they can be released back to the wild. We, you know, that's the whole job here. Rescue them and repair them, rehabilitate them, and release them. And so it's always a big deal to get these birds back out in the wild. Or if in this case we're going to keep a bird as an ambassador, or some other institution can use them as an ambassador. So we like to keep all these living creatures going. So anything, I think we've run out of time, haven't we?
It's about that time.
About
Yep.
that time. So, okay, so it's time for me to do the commercial. Okay. Okay. Commercial time. Okay. 50 new calendar for this year. Okay. So it's for 2021. Okay. And beautiful artwork there. This is Gigi's artwork that goes on the cover. And so they're a bargain at $15 a piece. You can go onto our website and you can order them. Okay. So you just push the little button. Boop.
Yep.
You know, and order the calendar.
Yep.
And so that's really going to help us out. I think we're well past 100 orders already. And so I think, what was the deadline on?
The 15th,
The
October
15th of
15th.
October?
So,
Okay, 15th of October.
and
That
then
way
no
we make
more.
Sure, yeah, so that's going to be it. So get your order in right away if you want them. And we have orders. I have one order all the way from England. So, okay. So that one, like, wow, okay. But in order to make sure you get them by Christmas time, you know, we want to make sure that, you know, we don't know what's going to go on with the deliveries, printing, you know, in case something has to be reprinted, or the postal service if they finally, you know, actually our postal service is very good here in Huntertown. We're very lucky. They make sure I get all the bills on time, and a lot of the checks.
that's
too.
thoughtful.
That's helpful. Yeah. So anyway, so just to cover yourself, you know, so you're going to get the calendars on time, and the $15 of course includes the postage or shipping for the except for the one goes to England. That's another story. So anyway, so that also want to thank all those people who have reacted to postcards that we sent out. We've brought in over $2,000 so far with our postcard campaign,
Yay.
and it's really going to help us out. It's just going over the cost of taking care of our birds. It costs us about $5,000 to buy food, because there's been a lot of reasons why we can no longer get the free food we used to. So we are still getting, hunters are turning in things like deer, roadkill, that kind of thing. But things like rats and mice and chick, we are starting to have to purchase those. And one of the reasons is, the COVID thing has reduced our sources. Avian flu reduced our sources, so we have a little bit of a difficulty. So we actually are out purchasing some of our stuff. Plus also, the other problem is, we're doing such a good job. We're getting so many birds. I forget how many birds we've had this year. Well over 200, I think, this past whole year from last September. So we've had a lot of birds through here. We've used up a lot of food. So we do need a little help. So we're estimating that this year we're going to be surpassing $6,000 in food bills. You know, and but we have some good managers, you know, watching the food and how much the birds are getting, because we don't want fat birds, which reminds me, that bird is looking just too fat, Chewy.
No, not Chewy.
Poor Chewy. What's he weighing now, about 4 pounds?
A little over 4
And
pounds.
he's what, 10 months old?
No, he's 5 months old.
5 months old?
Yeah.
Good grief.
He's a big baby.
Hey, baby. Okay, 5 months. I thought he was older than that. Okay.
Yeah,
So it's,
he's still a baby.
Yeah, Thena's what? This is September or February. So she's about 7 months old.
Yeah, she's a little
And
older.
she's only, what, 3 pounds?
Smaller.
About
bird.
3.5, I
So
think.
3.5.
Yeah.
She can eat well, too.
Yeah, she's small bird.
So, anyway,
Smaller
so,
bird. You're on his list.
okay.
Yeah.
So, anyway, so some of you guys that received
your
the
heart
postcard,
out.
I really appreciate, you help us out a little bit. Every little bit helps us. And so we make sure that the birds are well fed, getting good nutrition, and so that we can get them back out there in the wild doing what they're supposed to do. Hunting down prey. Keeping your backyard clear of rats and mice and stuff like that. And also out there making more babies so we can have more wildlife out there. So I think I've run out of words to say. You've run out of words, so thank
Yeah,
you.
Thank you.
And
Yeah.
Nicole and Freckles and Jeannie and Chewy. And of course our producer and cameraman, Gigi.
Yep.
So,
Hi, everybody.
okay, so we'll be back next week with another great topic and maybe another celebrity star. I don't know who we might get in for next week. So bye.
Bye, everybody.
Bye.
Thanks for tuning in. Bye-bye.